I'm going to talk a little bit about the work that we've been doing at the Gates Foundation, really to think about data in a different way than how we've thought about it. It's humbling for me to give this presentation in front of all of you, working in country who are really dealing with data deeply day in and day out. But what we thought would be useful would be to think about, what are some of the data that are needed to inform critical decisions, specifically around fortification, but this has implications across any micronutrient program. Next slide, please. So the first thing that we really thought about was just, what are the different stages of the data value chain and what's really important? And obviously, as we've been discussing the last few days, collection of data, making sure that there's good quality data, and that we're including all indicators that are necessary is absolutely imperative. But it's really the analysis and triangulation of those data that will help to inform policy and answer questions. So what we've been doing is we've been thinking about where there are opportunities for innovation around data, how data can be collected more frequently in a more cost-effective way, but most importantly, to be able to make sure that the data that are collected are meaningful to policymakers and to program managers. So we rely very heavily on networks of collaborations within countries and within regions. And we're in awe of what Lens has to offer and what Lens represents, because it's really the true cross-fertilization, if you will, of experiences around data generation, data analysis, and data use that's most important. We also think that it's really important to have centralized repositories of information. It's always striking, I think, that within your own countries, you probably have a lot of data that you're not necessarily all aware of. But to be able to have a consolidated repository that brings together all available information, whether it's on food consumption, dietary intake, micronutrient biomarkers, inflammation, is extremely important. So we've made some investments with the Global Fortification Data Exchange that Reed will speak to a little bit later, and how we think that that's important. The other thing that we've been doing is really thinking about filling data gaps where they exist. So we talk a lot about the big 5 nutrients: iron, vitamin A, iodine, zinc, folic acid. But there are many other nutrients for which we need information, and we just don't have data. Thiamine, riboflavin, niacin are critical nutrients that are potentially needed in fortification programs, but we have very little data on their magnitude and distribution. So we've been exploring ways, I'll speak about it this afternoon, together with the government of Uganda, to be able to generate biomarker data in a more efficient and effective way. What's particularly exciting about that initiative is that it links micronutrient assessment with data on infectious diseases and inflammation. So it will be possible to generate data at the individual level, but also at the population level, on what's happening with regard to micronutrient status, levels of inflammation, levels of infectious morbidity. And that data, when it comes together, can potentially be extremely useful in order to make evidence-informed decisions to improve programs. Next slide. So at the very core of what we're doing is just to make sure that countries, that you're equipped with the tools to be able to make the best decisions possible, but to make sure that the programs that you're implementing will affect those that are most vulnerable. Most vulnerable in this context means those at greatest risk of nutrient inadequacy or nutrient deficiency. And how do we identify those segments, those subgroups of the population, in ways so that we can better design programs, monitor programs, and demonstrate that they're having the impact that we hope that that will have. I want to just talk a little about, next slide please, sorry. I want to just talk a little bit about what's really driving a lot of our work. And Nigeria knows this well because they've just completed a major food consumption micronutrient status survey. Took several years to conduct. We heard from Maria Elena about the generation of those data. Now the hard work comes, and that is to make sense of these data. And how do we really put to use the richness of the data resource that's now available to the government of Nigeria? And one way to approach that is to think about what are the critical policy questions that need to be asked. So we wondered what those questions were, what those policy questions, what those decisions are along the large-scale fortification data value chain. So what this does is it just sort of, emphasizes the fact that there are critical questions around designing programs. Are we fortifying with the right nutrients? Are we fortifying the right vehicles? There are other questions around whether or not the fortified foods are actually being produced. Are they being produced to standard? And then once fortified foods are being produced, hopefully meeting standards, are they reaching the population? And in particular, those that are most vulnerable. And then the next question is, just that the population may be consuming fortified foods, are they consuming enough of it? So the dose, per capita consumption, is an important variable that's driving a lot of the decisions that are critical to inform whether fortification is having its impact that is required. Next slide. So we've just transformed a lot of these decision points, sorry for the small font, hopefully this will be shared, into what we believe are the critical questions along the feedback loop. And then next slide, for each of these different questions, we define what are the key indicators that are needed in order to respond to the different questions and to understand what are the sources of the data. And what we often find is that those data are just not available. If they are available, they're very old. If they're available at the national level, not at the subnational level, with the granularity that's really needed in order to really understand some of the differences within countries. And if there are gaps in data, how do we fill them? And I think that what I heard yesterday was that there's a really clear understanding of what indicators we need to collect in order to understand the etiology of anemia. But a lot of those data are just not readily available, and they're not available at a level at which they can be programmatically meaningful. So part of what we're trying to do at the Gates Foundation together with partners is to come up with really creative and novel approaches to fill data gaps. Next slide. I'm going to just speak a little bit about, some of our approaches on thinking about, one more slide, please, to thinking about whether or not fortification programs have really targeted the right vehicle. And it's a tough question because a lot of programs have just been designed because of, sorry, Lisa, WHO guidance, or because this is what we've been doing and what other countries are doing. But when we look at these data, when we look at the coverage of different food vehicles stratified by socioeconomic status, we begin to see certain patterns emerging. What the graph in the center shows is what is the distribution in the coverage of food vehicles by wealth quintile. And what you see is that there are certain vehicles like rice, like wheat, that are significantly more used by wealthy populations than impoverished populations and low-income households. At the same time, there are vehicles like maize and like bouillon cubes in West Africa that are significantly more consumed by low-income households. And understanding these data will help to inform the design of fortification programs so that ultimately they will be as impactful as possible. Next slide. This is just showing how we can make better use of existing data. I think that was one of the points that was made this morning. So using household consumption expenditure survey data, it's been possible to look at what is the distribution, not only in the coverage of different food vehicles, but in the per capita consumption of those vehicles. The graph in the lower right shows differences in edible oil consumption between urban areas and rural areas, and within those between 5 wealth quintiles. And what we see is a significant difference in the amount of edible oil that's consumed by rural poor households compared to wealthy households in the urban parts of countries. And why this information is important, again, is to understand that if we want fortification to be important and to be relevant and to be impactful, we need to know what the exposure is of those fortified foods, particularly amongst those that mean the most to us and are the focus of our programs. Next slide. And this is just a way that we further triangulate data and analyze data so that understanding what the current levels of nutrient inadequacy are, again, stratified by urban and rural area and wealth quintile, we see that because of the higher levels of per capita consumption of edible oil, and if that edible oil is fortified, it's going to have a dramatic impact on more affluent consumers in urban areas than on poor families in rural areas. So again, trying to use data in a way that will help to inform whether or not fortification programs are going to be impactful, will help countries identify which vehicles and which segments of the populations will ultimately benefit. Next slide. I'll try to go through this just a tad quicker. One more slide. So we know that there are gaps in micronutrient biomarkers and prevalence data and deficiency data. So the reality of this is that, while we heard yesterday from Maria Elena about the importance of household-based surveys, they're expensive, they're cumbersome, they take time. Are there alternatives? Are there different ways in which countries can collect data on micronutrient status that will potentially help to inform what the distribution and magnitude is of different micronutrient deficiencies? So trying to identify these and being creative and being a bit provocative is something that we've been exploring. And again, I'll speak more about a particular approach that we've been developing with Uganda. But suffice it to say is that we can't make decisions in the absence of data. We can't necessarily rely on conventional and traditional data collection methods, so we need to be creative and a bit provocative. And it'd be great to get some feedback on what some of those approaches are. Next slide. The other approach that we've been exploring is modeling data to be able to predict the probability of nutrient inadequacy or nutrient deficiency. So working together with the World Food Program and other groups, we've been able to identify what are the key factors that are associated with those different indicators of burden, and then basically model or predict the probability of deficiency. And what you see here on the top is basically different ways of thinking about inadequate intake for folate at the country level in Ethiopia, and being able to understand that through a predictive model, we're able to come pretty close in approximating what those different levels of nutrient inadequacy are. So rather than going out and doing a dietary survey, a household consumption expenditure survey data, it's possible to use available information to be able to predict the probability of nutrient inadequacy. And then using that data to understand where the vulnerabilities are helps policymakers to be able to make robust decisions. And then finally, I'm just going to make one final point and give the floor back to Mandana, is that one question that we've been exploring. Next slide, please. Again, just thinking about the conceptual framework for anemia that we've been discussing yesterday. Hit the cursor one time. What we've been looking at is, if you can hit the button, advance the slide once. And one more time, thank you. What we've been looking at is a relationship between iron deficiency and inflammation status. And what we know is that anemia programs haven't moved in the last 10 years. We got really clear presentations about this yesterday. And we know that at the same time, there have been iron fortification, iron supplementation programs that have been implemented in many parts of Africa. But these are countries with a very, very high rate of inflammation and infectious morbidity, where hepcidin levels rise, and the iron that is consumed is not being readily absorbed, that the mechanisms within the body are not enabling that to happen. So are we just continuing to implement the same programs with the same interventions and not having the results that we want? Or can we use data in a more creative way to be able to identify that we need to do things differently, particularly introducing iron fortification in areas of high inflammation to be able to address what can be done to be able to ensure that whatever iron is consumed is being readily absorbed. In the same context, what we heard yesterday is the importance of malaria. In areas where iron deficiency is not rampant and iron status may be replete, and we're providing iron in areas with high malaria endemicity, we could potentially actually be doing harm and we can be exacerbating or feeding the parasites in ways that can lead to an adverse public health outcome. So as we think about data, we have to be more creative and more nimble and come up with the necessary tools so that we can essentially design programs that will be efficacious, have public health impact, and ultimately be safe. Thank you very much.